So, good evening. I'm your host Ashlyn Danila, and I'm here with a school nurse at KCA University, and we want to learn more about COVID-19, its impact on her, and how it is faring on. So, nurse, can take it and tell us more about COVID-19 in a medical perspective.
My pleasure for this session. My name is Madam Gloria Mbaga, and I'm the university nurse at KCA University. I would like to talk about this coronavirus disease that will help even others who doesn't know more about it to know the signs and symptoms and even how to prevent it further. So I'm pleased to host you as my interviewer.
Okay, nurse, I know that in the field of medicine you are higher than us. So I would like to ask, like, how long does the coronavirus survive in air?
Coronavirus in air, it may take between 1 hour to 3 hours or even longer. Currently they say it may take even 8 hours in air.
Yeah, 8 hours. And also nurse, like, you see, after you are diagnosed with coronavirus, you're taken quarantine. So how do you know that this person is safe enough to get out of quarantine, to get out of isolation and go with the others?
When you get to the quarantine, that means you have tested positive. Yeah, you tested positive of coronavirus. So when you get to the quarantine, you have to stay there for 14 days. After 14 days, we expect that the infectious period has gone down, and therefore one can get out of quarantine. But the person should also take precautions of protecting still other people. Yeah. And even protect self from acquiring a second infection.
And so the nurse, like, COVID-19, when it came out, all this stuff about people dying and it was spreading very fast, the CS of health, yeah, kept a lockdown and people were not in school. So how was it not being in school, and how did it affect you and your profession?
With my profession, it really affected me because even when I was away from school, in my community, there is a hospital which I give services to. It's a CSR of my own. So when I had to go and take care of the sick in that particular hospital, so it affected me in that I also got infected in that period. During that period, I got infected. In fact, I've contracted twice. The second time I got it when we had just opened, but now when it was on high, it was on high notch, that's when I got it when I was in the community. So that is how it has affected me as a nurse, and it has made some people, especially the health workers, not to be free with the patients or with their clients. It becomes a bit difficult also, knowing that when you interact with this person freely, you may walk out with the virus. It has also affected me, especially in my family, because when I come from work in normal times, I have kids who run to me. So and even if I'm not clean, that is when from my work in normal times I have to go home and they should run to me. This time of corona, I don't know who I've interacted with, and I've done a lot of trips here and there, and I've met with many people. So getting to the house, I have to hide, sneak to the bathroom, make myself clean before my kids hug me. So it has affected me in that manner. In a positive manner, it has actually encouraged us to embrace digital medicine, the telemedicine. I can take care of patients over the phone. Yeah, we just call. We have a number for the KCA clinic. You call, and then you tell me how you're feeling, and then I'll give you directions. Then maybe you can come the following day for medicine and for further management. That's how it has affected my life.
So as you say that you are infected twice.
Yes.
So was it severe from the first time? Like what was the experience? First infection and the second infection?
I can say the first infection was worse. The first infection, though it wasn't severe, it didn't take me to the ICU. I quarantined myself just in the house, but the signs and symptoms were worse. I had to infect also my kids and the people I stay with. Yeah. So the signs and symptoms, I had a lot of fever, some pains, headaches, sneezing, all those. But we managed, all of us managed to come out. Nobody went to the ICU because of lack of oxygen and blah blah. The second one, I didn't know I had it. Just walked to the hospital. I was feeling a bit unwell, and when they said that before admission in that hospital, every patient has to undergo a COVID-19 test. So they tested me and I was found positive again. But that time I can tell you I didn't have any signs. Didn't have fever. I didn't have coughing. Didn't have headaches and so no, I was just okay. But I was told after testing that I was positive. So I had to stay again away from school for 2 weeks. Yeah.
And so now coming back to school, have you met with students who have contracted the virus?
We have suspects, many suspects. Yeah, because we don't have the test kits so that we can say we've tested this person has a COVID-19. We've not had even that active case that actually needs maybe oxygen, that will be rushed to the ICU, that we could just say this person actually is COVID. No, but we have suspects. Those who have all those signs of symptoms of COVID. And we've sent even most of them for the test, and most of them have gone for quarantine and back. And actually most students are infected. Our lecturers have been infected through the same. Our health workers, all of us have been infected at one time or the other. Yeah.
And so now it's like, what do you think about these vaccines? Are they effective and are they going to help us in the combat with COVID-19?
The vaccines, they are effective. Before a vaccine is given out to people, it usually undergoes some kind of testing on animals, yeah, guinea pigs. So to me, because it has been tested, it's effective to human. And even if it gets you, because there are cases whereby you find that a person has suffered already the COVID disease, and then the person is gets vaccinated, in fact all the two doses, but still the person is stricken with another one, COVID disease. So when the person gets stricken with another COVID disease, you find that with another COVID disease, you find that the person now starts getting worries why, and yet the person has been vaccinated already. Yeah, so you find that it won't be as severe as it was before. It will be a bit lighter. It won't send that person to ICU. It won't make that person difficult in breathing. You'll be a bit fairer. Like me, the other time I told you the first one was so hard. Yeah. Then this one I didn't have even signs and symptoms. Yeah, so it becomes moderate or even mild.
Okay, so that's all. My last question as I go, like, people out there, they've been like, the CS has been just saying about go take the vaccine, and people are complaining like some things, like some people think that this is one ticket to getting to Illuminati. Other people say like after the